Thank you, Dr. Jenny, for coming and sitting with us. It's nice that we have such a unique point of view for this interview. We've interviewed only medical doctors so far, so it's nice that you have a nutritional and hormonal biochemistry background. On your website, you have this phrase, "You are what you absorb." And I really like that. I like that it's very similar to Hippocrates' quote, "Let your food be your medicine and your medicine be your food."
One of my favorite quotes too.
Can you tell us how you chose this whole body approach to medicine and what drove you to that decision?
Well, I look at the body as an integrated whole. And I tell people, our bodies are the most comprehensive piece of machinery on the planet, very much like cars. You're going to take your car, you're going to take that car to an engineer, a mechanic, right? And that mechanic is going to go in there to maintain your vehicle, make sure that it's running efficiently and optimally. If people don't do that, you're going to start falling apart, and then that's when your car starts to sputter.
Yeah.
It starts to get a leak. You know, the tires get flat, the spark plugs go out of whack, gasoline runs out, oil runs out, and what does that do? You have a lot of people that are riding their vehicles with gas but no oil. What does that do to your car? Your engine blows out eventually if you're just running on gasoline.
A lot of damage.
Everybody here in the United States, a majority of them, I would say, are running just on gasoline alone. And I describe the endocannabinoid system like the oil that's in our car that's required for the mechanics of our vehicles to run more efficiently. And so that's the whole body approach. If we maintain our vehicles, in essence, we're going to be fit, we're going to be disease-free, preventative. So functional medicine is my specialty. So evidence-based, meaning focus on the biology, not the pharmacology. Test, don't guess. What is the root cause of the symptoms that you're having, as opposed to just going to big pharma and getting the pink pill, the purple pill, the yellow pill, that pill. Here's your Band-Aid for your boo-boo. Come back in 6 weeks and I'll give you another Band-Aid for the boo-boo that prescription that I just gave you caused.
So rather than treating the symptoms, you're going for the cause for everything that's possible.
Exactly. And it is. We're all chemical. Chemicals that run us. If I give you a shot of noradrenaline, epinephrine, what is that going to do to you? Epinephrine, that is the wig out, right?
Pretty hyper, yeah.
Yeah, you're super hyper, right? And if I give you a shot of tryptophan of 5-HTP, you're gonna get super sleepy, right? So the opposite effect. So it's the same thing with everything. We eat to feed our mechanics.
Very true.
And what's going on in this country? GMOs. Everything is genetically modified. Another clue on why nobody is pulling out the phytocannabinoids from their food, from GMOs. There's no nutritional value. So we are absorbing nothing. We are what we absorb. We are absorbing nothing. We're absorbing 10% of what's in our environment.
Very true.
Right? So Monsanto is making sure of that.
And that's a whole nother thing that we could get into there, especially with GMOs and poor nutrition nowadays.
Yep.
But how long have you been practicing sense medicine? Or how long have you been practicing?
Let's see, I've owned ageVital Pharmacy Research and Wellness for 5 years. Before that, I ran a clinic here on Main Street called Energenesis Institute. So I would actually be a clinical advocate for doctors and for the consumer. So I would teach doctors how to practice medicine like this.
Gotcha.
Before that, I was running pharmacies. So I was opening up phaRmacies for other people. So they would pay me a lot of money and I would start facilities like this.
So you have experience in all aspects of this.
Yeah, full service pharmacy. ageVital was like a byproduct of all of my experiences.
Gotcha.
So pharmacy, research, wellness. I have a clinic in here. I have the pharmacy, retail side, so all the big pharmaceutical garbage. And I also compound, so everything is customized per individual as opposed to just cookie cutter medicine. So even my cannabinoids are customized. My CBD products are customized based on the testing that I do for people. So if somebody needs a specific delivery mechanism because they can't swallow, I'm going to go ahead and compound a CBD product that's based on that individual's needs. Some people can't absorb, through their skin. So then I'm going to create a different way, whether it's a suppository, whether it's a cream, a rapid dissolving tablet, whether it's in an injectable form, which I'm actually working on, injectable CBD.
And though I'm sure you're ahead of the curve, I really feel like that's where people should move to, is tailoring it specific to each patient's needs.
Absolutely. Custom medications is definitely the way of the future. If you don't do that, everyone's biochemically unique.
Everyone's different.
What works for me is not necessarily what will work for you.
Yeah. Okay. Awesome. Thank you. And what led you to discover cannabis and the importance of the endocannabinoid system in the first place?
Believe it or not, it was a neurologist, and he's here locally, Dr. Ronald Undin.
Okay.
He's a neurologist, psychiatrist, wonderful, wonderful clinician, and he was so fascinated by marijuana. And a lot of places that he would go to, he would just say, "How do you guys feel about marijuana?" So they kind of poo-poo him.
Okay.
Like, what is this doctor talking about marijuana for? He's like, well, don't we have the endocannabinoid system? So we started researching, and eventually we crossed paths about 5 years ago. And he's like, can you make a cream that can target the brain stem from the back of the neck? I'm like, yeah, absolutely. And that's where this came from, the CD derm.
Okay.
So I do this for animals, I do this for pets, but it's a topical, not transdermal delivery mechanism that goes right on those afferent nerve endings, cutaneous nerve endings on the back of the neck. Because why put something here to metabolize when the problem's up here?
Right.
If it's all chemical, and that's where the signaling starts.
Yes.
I'm going, this is brilliant.
It makes sense.
I don't know how I feel about marijuana. I was never a smoker, so this was a whole new thing for me too. And I'm going, oh my gosh, this is phenomenal. This is just like, Whole Foods eating. This is a plant that God gave us, where we're pulling the sustenance that we need to make sure that our neural synapses are sparking. The spark plugs in our brain. This is what makes those chemical connections work in our body. All right, so even vitamins and minerals and hormone therapy is not going to work if those neural synapses aren't sparking correctly.
Very true.
Yeah, so think of radio waves, think of, how the signals going back and forth, a telephone, how those signals go and they cross. So something, if there's a metabolic block inhibiting, that telephone from calling somebody else in Kentucky, for example, so think of the endocannabinoid system like that. Phytocannabinoids we eat, and then it activates our endocannabinoid system. CB1 receptors in the brain, CB2 receptors in the gut. So we actually have receptors in our body to regulate these wonderful chemicals in this plant.
And even this knowledge that you've had for only maybe 5 or 6 years or so is far and above beyond what a lot of other people have and just their cursory knowledge of cannabis. And even doctors in our state are very uneducated in this.
Yeah, I devoted my time, literally about 15, 16 hours a day, just researching and collecting all the data that I could. I'm going, why isn't this out there?
I love that you have your own products, the VitalCBD. How did that come about from your knowledge of cannabis?
That came about when I discovered the different medicinal properties, the antifungal effects, the antibacterial effects, the anti-epileptic effect, inflammatory, MS Parkinson's. And as patients were coming in and saying, Doc, I don't want to take Prozac. I don't want to take Xanax. I don't want to take Valium. You're right. This is a Band-Aid for a boo-boo. I'm doing more damage in my system than I'm doing good. And I am having a longer list of side effects than benefits. What can I do? Besides nutritional therapy, besides hormone therapy, where can I take it to the next level? I really want to feel alive. I feel like I'm just existing, but not living.
Yeah.
And I'm like, how do you feel about cannabis? And I show them the pictures on my wall, and they're just like, wait a minute. I was like, this is just like a plant, just like oregano, just like cilantro, just like spinach, asparagus. I said, all of these foods have a purpose. We eat for a purpose. Let your food be your medicine, and your medicine be that
exactly,
food.
Yes.
Right? I was like, so what kind of chemicals do you think are in this wonderful plant that help us neurologically? And they're like, well, let me try it. And then I started making little samples. And then right away, this started a whole entire challenge. I called it a challenge. Like, come in here for a free sample of CBD.
Right.
Someone come in here with a panic attack, and within 30 seconds, their panic attack is gone. I'd have people here on the main street coming in with migraines and going, I heard that you gave a sample that takes away my migraines in 30 seconds.
Right.
I'd give them a CBD rapid dissolving tablet, and within a minute, I was like, mainstream medications, it usually takes about 25, 30 minutes to target the migraine or the headache. So to have something that can take away a headache or a migraine within 30 seconds to a minute is revolutionary.
A person's own experience is going to weigh heavily in their mind when they decide everything later on.
Exactly. Well, what are the commercially available medications for migraine headaches? Sumatriptan, ibuprofen, acetaminophen, tramadol, gabapentin. Think of all these toxic band-aids for boo-boos. We're not gabapentin deficient.
Yeah.
We're not sumatriptan deficient.
Very true.
We're not Imitrex deficient. We're not ibuprofen or acetaminophen, Tylenol deficient. We're not any of that. These are all toxic chemicals that our body doesn't recognize. And then you have side effects from it. not only is it destroying the endocannabinoid system, it's destroying the good bacteria in our stomachs.
And so many other
Cannabis,
things, yeah.
right? The cannabinoids actually enhance neurotransmission, actually feeds cells, actually kills bad bacteria. It's antifungal, it's antibacterial.
See, when you know science about it, it almost makes you wonder who's against it.
I wonder.
Did you work on your own VitalCBD by yourself? Were you the
Yes, that was 100% my line. My team, I have a microbiologist, I have PharmDs, I have RPHs, I have RNs, I have other MDs that work in my facility. So we're like, let's go to the think board and let's create the best product out there. Non-GMO, 100% organic, 100% bioavailability. So, and I think that's what's setting us apart. When a lot of people will go and they'll buy cannabis products, CBD products, and they're like, well, I didn't feel anything when I took that oil from this company, or I didn't feel anything when I took that oil. And then I end up testing their products, capsules that say 40 milligrams, but the bioavailability is probably 2 milligrams. I think a few of them. I tested about 250 different products. I won't name who they are, but a lot of them were, I'm going, oh my gosh, because they're not being regulated by clinicians. It's like, these types of products should be made by chemists, by microbiologists, by pharmacists, by doctors. You need a complete medical team to do this. And then you're going to have a superior product. It's not just, oh, let's get some cannabis, put it in a capsule and hope it works.
No.
That's not how it works.
The product will speak for itself.
Right, exactly. You got to take into account the xenobiotics in the guts. Yep.
Earlier on, as you were saying, everyone is different. Every person that doses is different.
Yeah.
But what would you say is something that you've seen as the most effective way to dose with CBD?
The most popular product, I would say, would have to be between the rapid dissolving tablets and the vape. So I think there is a superior delivery mechanism through the oral mucosa or inhaling it. So the oral mucosa goes straight to the brainstem, and inhaling it goes straight to the brainstem. And then I do have a lot of athletes that just love the topical cream. So it's very similar to the oral mucosa, the back of the neck. The bonath is what we're calling it. It's a medical, terminology, bonath, back of the neck, at the hairline, applying the CBD. And you could do that with the CBD oil. You can do that as a cream. But I even use it for dermatologists. I get a lot of referrals from dermatologists for acne. Applying CBD topically on pimples. And guess what? Since it's antibacterial, the pimples go away. Because the pimples are from bacteria.
So it's like a miracle. Yeah. Have you received any negative repercussions or pushback for supporting marijuana?
No. So far, because I'm able to inform other providers and the consumer, I'm doing local seminars here. I'm speaking about it, on a network. So ABC, the local network, and I have a syndicated show with NBC called Daytime, and I'm able to, once somebody hears about it and they see the science, because the science doesn't lie. This is not like big pharmaceutical companies where they pay, the government to pass something, and then later on you find out that the black box warning, they hit. They have all of these side effects. Cannabis doesn't have, unless it's genetically modified cannabis or cannabinoids, it does not have negative side effects.
Good to hear a doctor say that.
Yep.
And how do you feel about the way that our state has handled regulating cannabis thus far?
I'm not discouraged, but I'm very disappointed. I feel like our hands are being tied, and we have to push against the grain, and we have to fight to actually give the consumer something that is making them feel better. Because number one, I always tell people, I'm a humanitarian, number one. I love people, and people deserve to have access to health, not healthcare taking. And that's what this country is doing. And Florida has become such a burden. We're just fighting. We're having to go to Congress. We're having to go, to all of the hearings with the state. It's like, it shouldn't be that hard. Right. Our food should not be genetically modified, where we're having all of these inflammatory issues and neuropsychiatric disorders, cancer, fibromyalgia, migraines, insomnia, little simple things like that. 80% of the people that I talk to are depressed. I'm like, this should not be. You should not be dealing with depression. You're 21 years old. I dealt with a 12-year-old that came in here, a referral from a psychologist here locally. I'm like, a 12-year-old that's depressed? Are you kidding me? What is going on? What is in our foods that is making you feel like this?
There's got to be some
What
common
is not
cause.
in our foods that's supposed to be protecting your brain? And CBD is one of those.
And then you need to be asking those questions. You need to be looking at that, and not just accept what's
And they
going
need
on.
to. I think education, I think the more the consumer knows, the more they'll be able to fight back. And the more the clinician knows, because 99% of the clinicians that I'm dealing with, they want to help their patients. They always tell me, I did go to medical school, I did spend 15 years in medical school to make people sick and inflamed and cancer. I'm watching them die. I'm giving them something and it's making them worse. Like I'm getting, a lot of these good doctors are, just jumping, off the medical bandwagon. Like, I didn't do this, I'm gonna go find something else to do.
Right.
Because they're refusing to, to treat their patients if they can't really treat them functionally.
Is there something that you've seen that you would say might help the representatives? Like, is there something that you've seen as a pharmacist that you might offer as advice to the legislators and say, hey, listen, maybe try doing this and that would work a lot better?
I think they need to do like a think tank of clinicians.
Okay.
I think legislation, instead of just going to the consumer, I think they need to go to the doctors. I think they're doing it backwards.
Okay.
So they're trying to make the doctors, scared. Federally, it's illegal.
It seems like it.
Yeah, they're trying to scare the doctors, where the doctor's like, I don't even touch it. Oh my gosh, I'm so scared I'm going to go to jail. Well, they're not enforcing it, So they're saying it's illegal and they labeled it as a controlled substance, but they even said and issued that, they're not going to invest any money to enforce to put you in jail for it. So basically they're saying you can do it, but it's illegal. Wait, what?
That's true, yeah.
How can that be?
Marijuana, especially in this country, is just a conundrum and an oxymoron.
Yes, well put. But doctors definitely need to stand up and create a medical marijuana group where they go to Congress. Can you imagine couple hundred doctors going, couple thousand doctors going, couple 100,000 doctors going?
Oh my God.
We're going to close our practices if we're not allowed to practice medicine the way we want to. Who are you to tell us how to prescribe? Who are you to tell us how to do our trade? Are you a doctor? Did you go to medical school? Who are these people? Congress came up, well, are they doctors? Are they chemists? Are they scientists? They have no idea what they're doing. And half the time, big, huge industries like Big Pharma's paying them a nice big dollar. Don't pass that.
You got lobbyists.
Make it harder.
Yeah. Yeah.
Absolutely. I met a couple of them. They're not very nice. Yeah.
True. Well, that was kind of all the questions that I had for right here, just for this segment. One question I had left was, one thing that both people for it and against it are calling for is more testing. Because even though there is a lot of testing in other countries and around the world, there's very little testing, if any, that's done in America. If you were in charge of, say, doing some testing, what would you test first in order to prove or disprove certain notions about cannabis to people?
Well, I will say something that is really sloppy in this country with medical cannabis, that there is no regulation. I'm a regulated facility. I'm required to test everything. I can't put anything on my shelf without first, providing a certificate of analysis from an approved testing facility that's regulated.
Right.
So you have the CGMP standards. None of these companies that are manufacturing cannabis products are CGMP certified, or they're not USP 800, USP 797. So these are all standards, 503B, 503A, facilities. So 3-letter agencies are the ones that go in and regulate to make sure, this is a legal pharmacy.
Right.
You have a certificate showing that you're a regulated facility, so that way a patient comes in, a doctor knows how to identify whether I'm actually giving you something that was tested for parasites, for funguses, for heavy metals, for molds, making sure it's not from a GMO. The people right now, some of these grows are just jumping on the bandwagon. They're just wanting to get on everybody wants it, let's make a quick buck. They're not thinking of the consumer and the individual. These are our children, these are our grandparents, these are our loved ones that are taking these products. You want to make sure that you're getting the pure, 100% unadulterated, cannabinoid. It's organic, and the body's going to recognize it. You don't have an incident where you take one puff and you put yourself into a coma.
Yeah.
And there's incidences like that. They keep it out of the news, but it's there. That shouldn't happen.
Absolutely.
Right.
Patients
And then
want-
regulating it. How do you know what the strength is? How do you know, somebody that's 500 pounds, you're going to give them the same plant as someone that's 105 pounds? Someone that's 300 pounds? Someone that has, certain genetic predispositions and can't
Right.
metabolize something the way
Right.
another person can?
Yeah.
So you need to know exactly what somebody's taking. That's why customized medication is so wonderful, because then you know that individual very well.
Do you provide any of the test results from your products for patients to see or for consumers to look at?
Oh, absolutely. I provide certificate of analysis for everything. My vitamins, my nutraceuticals, my CBD, my pharmaceuticals, everything. My skincare line.
Very
Everything is tested. And I get inspected all the time too. DEA, Board of Pharmacy, everything. FDA, every three-letter agency.
Well, that's really about it. I can't thank you enough for sitting down and talking with us and
Yeah.
giving us all the attention.
Perfect. Do you want to go look at some products?
If you don't mind, yeah.
Yeah.